Laparoscopic gastropexy reduces gastric dilatation volvulus, also known as GDV, or bloating in large breed dogs. Many large-chested dogs are prone to a digestive disorder called GDV or bloat. The condition occurs when the dog's stomach fills with gas and twists, cutting off blood and oxygen to the stomach. This condition is extremely painful and if not treated urgently will result in death. Gastric bloating primarily affects the following large breed dogs. Consequences of not addressing gastric bloating can be devastating. Studies show dogs with gastric bloat that don't undergo a gastropexy have recurrence rates of more than 70% and a mortality rate of 80%. Prophylactic gastropexy surgery is recommended by many veterinarians. This procedure attaches the stomach to the abdominal wall to prevent twisting of the stomach. Many pet owners choose to have this procedure performed at the same time of a spay or neuter. This procedure can be performed using minimally invasive techniques that offer the patient the following: decreased anesthesia time, smaller incisions that reduce risk of infection, less scarring and pain postoperatively, quicker return to normal activity. This procedure is frequently performed as an outpatient procedure. This procedure can be performed during a spay or neuter procedure. The following procedure video demonstrates a laparoscopic gastropexy. An overview of the Vetovation surgical system follows the procedure video. The patient is positioned in a dorsal recumbency. Hair is clipped wide to the right, lateral abdomen. The first port is placed approximately 2 to 3 centimeters caudal to the umbilicus. A small skin incision is made and the subcutaneous tissues are bluntly dissected to the level of the linea alba. Fascial stay sutures are placed on either side of the linea alba. An incision is made and a blunt-tipped hemostat can be introduced to ensure full entry into the abdominal cavity. The trocar is then placed into the abdomen through this incision. The laparoscope is then introduced and the abdomen is explored. Additional ports are placed under direct visualization with the aid of the laparoscope. The stomach is visually identified. The abdominal wall is palpated with a finger or needle to determine the relationship between the transverse abdominal muscle and the pyloric antrum. Under direct visualization, a 5mm port is placed in this location. This port will be incorporated into the gastropexy. The pyloric antrum is grasped. The stomach should be comfortably lifted to the body wall through this port. Once the stomach is lifted to the body wall, the CO2 is evacuated. Once the stomach is held in place, a skin incision is made around the lateral port, parallel to the direction of the last rib. The CO2 is evacuated from the abdomen. The muscle layers are individually transected until a 5 centimeter full thickness incision is made in the body wall. The stomach is exteriorized through this incision. The pyloric antrum is palpated. A 4 to 5 centimeter seromuscular incision is made in the pylorus. The seromuscular layer is sutured to the transversus abdominal muscle in a simple, continuous pattern. A 2O or 0 long-lasting absorbable suture material such as a PDS is used to suture the gastropexy in place. the muscle layers are closed individually once the gastropexy has been sutured in place. Laparoscope is reinserted into the abdomen and the pexy is visually identified. Pictures are taken and recorded and provided for the patient following the procedure. The Vetovation surgical system provides an affordable platform for your practice to start offering minimally invasive procedures safely and effectively. The Tyson tilt table from Vetovation is designed to rotate any size animal to provide optimal exposure of the operating field. The integrated camera and light source are compatible with a variety of endoscopes. The laparoscopic instruments are multifunctional for a variety of procedures. The benefit of the Vetovation surgical system is affordability, simplicity, and the ability to add components as your practice expands its minimally invasive surgery solutions. The MySeal reposable thermal ligating device is the first and only reposable device that simultaneously fuses and divides soft tissue using direct thermal energy. The 5mm laparoscopic instrument consists of a reusable handpiece and reposable tip. The tip utilizes proprietary thermal fusion technology to facilitate the precise application of heat, minimizing collateral thermal damage. Patented thermal fusion technology provides the ability to quickly and safely coagulate and divide vessels up to 5mm in diameter. The energy is transferred to the tissue when a finger button is activated. The MySeal has a compact, portable power supply. The jaws deliver a combination of compression and focused heat with minimal thermal spread. The jaws can be used to dissect, grasp, and seal and divide, reducing instrument exchange. Vetovation would like to thank Dr. Elaine Holmes with Veterinary Specialty Hospital, or VSH, of the Carolinas, located in Cary, North Carolina. Please contact Vetovation if your practice is interested in introducing or expanding your minimally invasive surgery offerings. Thank you.